Hello, everybody. Welcome to Fits on the Go at ACC 24 in Atlanta. We are very happy to be here and excited as well. It's a beautiful day. My name is Amanpreet Singh Vasir. I'm a medical student from India representing the ACC member community at ACC. Joining me is Adriana.
Thank you, Aman. I'm Adriana Mares, and I'm an ACC Medical Student Leadership, and I'm very honored to be here with you, and of course with our very special guest speaker today.
So it is my absolute honor and privilege to introduce to you all Dr. Dipti Itchhaporia, who is ACC's past president. She is a Master of American College of Cardiology, Fellow of the European Society of Cardiology and the American Heart Association, and she's an interventional cardiologist herself. Thank you so much for taking out time to speak to us, Dr. Itchhaporia.
Thank you so much. Thank you so much. It's such a pleasure to be with both of you. I'm so excited.
So I think the main points of discussion today would be on future of cardiology as far as AI is concerned. Artificial intelligence is coming in a big way, and we really would love to hear your thoughts on that. And another thing which we thought would be prompt and apt as far as this interview is concerned is health equity, and where do we go from now on? So I think let's start with the first question. As far as where do you see cardiology as far as the next decade is concerned? With AI coming in, what role will it be playing, and how will it change clinical practice?
So I think that we call it artificial intelligence, but we like to think of it as augmented intelligence. I think that this is something that is going to be part of our future. In fact, if you look at what the FDA gets in terms of applications for AI products, following radiology, cardiology has the greatest number of applications beyond that. So cardiology already has a lot of AI tools embedded in our software that we may not even be aware of. When we do an ECG read, for example, and you get the automated read, that's AI driven. But now we're seeing AI proliferate in a lot of our tools, particularly in the imaging space, but we're doing AI analysis of ECGs for diagnostics. And then I think long-term, maybe therapeutics also. So I think that AI is here to come. What I see, though, is that this is an opportunity for all of us, students, the residents, everybody, to start saying what it is that we need. What are the unmet clinical needs where AI could help facilitate our and make things easier for our life? I will tell you that since the release of ChatGPT, generative AI has really been something that we're really looking forward to, maybe making our lives easier, helping us in terms of charting and other things. So I think the future is very, very bright for AI. We should not be afraid of it. We're not going to lose our job. It's going to augment what we do. And I think that we all need to start playing a role in helping co-develop the products that we need, learning as much as we can about AI, and sort of changing the direction with which AI goes. This isn't going to be something that happens to us. We want to direct this train.
Thank you so much. I think it was very well put forth, and I think we all have a take-home message from here as far as how helpful can AI be in clinical practice, patient care, managing records. I think we all have a lot of unmet challenges which we together will definitely work for. I think I'm handing it over for the next question.
Thank you, Aman. Our next question for you, Dr. Itchhaporia, is knowing how actively you're involved in the Health Equity Task Force, we're wondering what the next steps are for health equity in this year's agenda for the ACC.
Thank you very much, Ariana. So, we started the Health Equity Task Force almost now going on to 4 years ago. And when we started, we knew that health equity had to be part of the work that ACC does. And it's been part of our strategic plan. But I don't think we had actually actualized it. And I think with the work group, we actually did a strategic plan. And now that is incorporated into the larger ACC strategic plan. So all of the work that we do will be aligned with the thought that this has to fit with health equity. Now, interestingly, I also had presented this to our International Assembly of Governors. And, I think they initially was thought, well, this is more of a US problem. And what we're finding is that this is a worldwide issue, health equity, and that how we deal with health equity is going to be very important. I think the COVID pandemic really brought to light the fact that there are health inequities that occur all over the world. The other thing that we learned was about social determinants of health. And what we learned is what we do as clinicians only decides 20% of a patient's outcome. That the additional 80% comes from these social determinants of health. What is their economic status? Where do they live? All of those things. And so as much as those seem like very large issues, we as clinicians need to acknowledge those social determinants of health, advocate for our patients, and figure out a way to reach the most underserved populations. Because ultimately, if we're going to move the needle on the outcomes for cardiovascular care, we have to reach those populations. So to cap it up, we are now going to be a health equity committee at the college. We have a strategic plan for dispersing health equity and how it's going to be part of the culture of the college. And I think the culture really of cardiovascular medicine.
Thank you for your words, Dr. Itchhaporia, on the importance of health equity and the next steps for health equity and the task force with the ACC. It's been a very insightful discussion, and again, an honor to have you with us, Dr. Itchhaporia. Thank you for your time. And for more interviews like these, please visit our YouTube channel at www.youtube.com/FITsOnTheGo. Thank you.
Thank you so much.
I want to thank Aman and Adriana for this interview and this opportunity to talk about AI and health equity.